Hi there, and welcome to Canceling COVID. I'm Tanya Rivens. It's been a minute since I've been live with you all. So much happening. Of course, I appreciate you tuning in every Tuesday at 11 o'clock. Last week out of the studio, and the week before that, an event with my nonprofit. But we're going to continue to come to you every Tuesday to keep you informed, keep you up to date. Canceling COVID now in our second year. We're so grateful to our sponsors, our support. Couldn't do it without the wonderful Groundwater Solutions, groundwater-solutions.org, 704-596-0505, 704-596-0505, as we work hard to keep you informed. Real talk, real solutions, and just candid conversations about what's happening with COVID. So, of course, as we talk today, some exciting information. We're going to talk about grief coaching, and Lord knows we've been dealing with so much. So, a lot of people are having to deal with grief. You might be surprised at some of the information that comes out of that. But we always get started with none other than Dr. Tracy Black of Groundwater Solutions. She's always here, willing to help, and has helped me build this thing, which is what I'm so grateful for as well. So, good morning, Dr. Black, and thank you so much for joining us.
Good morning, Tanya, and good morning, audience.
Yeah, this conversation, we're going to keep it going. And I mentioned talking about grief counseling, but I just wanted to talk. You always bring us up to date. So, kind of before we even get into the questions that I have, let's set the atmosphere on what you guys are seeing today. Meaning, it's always good to find out, get a pulse on what's happening in the community, because right now things are starting to look like the new norm with the
Mhm,
concerts and outdoor
mhm,
activities and people just having fun. So what
mhm.
are you all seeing from your side?
Well, Tanya, you mentioned grief counseling. We are seeing again a lot of mental health issues
Mhm.
with regard to COVID-19, with regard to family issues that, COVID has brought up so much from that has been dormant, things that we
Right.
haven't talked about. And people have been hurting for a long time. And I think COVID-19 has brought all of that to the forefront. So we see lots of folks with depression. The hospitals are full with folks who are struggling with mental health issues. We have seen an increase in suicidal ideation and
Mm,
attempts over the last several weeks. And unfortunately, some successful suicide attempts have impacted our Genesis and groundwater communities. And so we
mhm.
have a lot of folks here who are grieving. A lot of tough conversations are being had. But what it lets us know is that there's a need for more awareness and education across North Carolina because it's hitting in every area, every demographic. We're seeing it.
Well, I see you guys hopping on. Feel free to make your comments and share. Let everyone know. Frederick Love, good morning. Thank you so much for hopping on. If you have any questions, just drop them in the chat and we'll share. And certainly we'll get answers for you. Or if not, refer
Mhm.
you to where you can provide those answers. That's what we talk about, a real
Yeah.
talk, real solutions. Interesting you hit on that. It was last week, I believe, or possibly the week before. No, I think it was last week where the interstate was shut down for that exact reason. Someone
Really.
was on I
Mhm.
277 and
Mhm.
it was one of those situations. I was under the impression or heard that there was some funding that was being a lot of funding being made available for mental health. I know one group that got millions,
Mhm.
and they work with the faith community. Are you seeing that type of support coming through?
And we hear that it's trickling down the pipeline. I don't think at a grassroots level, a street level, that
Mhm.
we've seen the funding that will allow us to get out there and get the word out. But I do believe it's coming, and I think we're finding creative ways to to deliver education, and we're collaborating with lots of other grassroots organizations because it matters, and it's affecting seniors, it's affecting middle-aged adults, and it's impacting our young people. So, we've got to just do what we have to do to save lives because it really matters. And when you lose somebody, it hurts. And
Yeah. Well, and you mentioned young people was going to be my next question. I surely hope CMS or some of these curriculums will build in a whole session for our young people concerning mental health and mental wellness. And
mhm,
just as we talked about, normalizing the conversation about therapy without people thinking it's something to be ashamed of. I can only pray that that is something that's being considered and maybe we can, as a community, start demanding these things from our
Mm,
educators. So,
mhm, mhm,
shifting from that, though, one of the things that I don't think we're paying any attention to, and I know you are,
mhm,
these numbers are starting to really take off in Europe. I saw an article that said, "Hey, before you take off on these, pandemic travels, you
right.
might wanna check some of these locations because COVID is starting to spike again in Europe." I believe,
Mhm,
well, I see right here on Germany, they set a new record for infection rates for the 4th straight day.
right.
Austria has reached new highs. The
Mhm,
Netherlands have doubled,
mhm,
since lifting their curfew on February 25th,
right.
and they're talking about this new transmissible strain of the Omicron variant. I
Right.
think called it the Deltacron or something
The
along
Delta Cron or the they've put another acronym B.
BA.2
Yeah,
is what I see.
exactly.
Yeah.
Yeah, yeah, and so they are the numbers are rising all over Europe, including
Mhm,
France, Austria, Germany. You mentioned all those that are the numbers are really high. And we know, and we've seen it with the original strain that came through the United States. You know, it started in China and
mhm,
Asian countries. It went through Europe and Italy, and then it came to the United States. And so we do need to be really careful, and we need to be mindful that we're not done yet. You know, we keep talking about it every week, but folks are letting their guards down, and they're upset with people who are taking precautions. But again, you know, we're going into the spring, we're going in, heading into the summer, and folks are going to start traveling. And if we're looking at going across seas and going to other countries, you know, we don't want to end up stranded there and having to quarantine or isolate in those communities away from home. So I recommend staying in your, you know, general vicinity when you travel,
mhm.
um, and making sure that you can get home.
So, Doc, I gotta ask you this, and again, this is Dr. Tricia Black of Groundwater Solutions. My mom is watching, so hi, mom, and my sister. Thanks for putting her on. Um, I'm just it just blows my mind with I mean, why aren't we doing more? We know it's coming, and here we
Mhm,
go again. This will be another wave that's gonna potentially get here and start wiping everybody out again, and to see that
mhm.
it's more, aggressive than the Omicron, where you even described it as if you walk in the room with someone that had it, more than
You're
likely you're gonna
you're
get it.
gonna get them. Mhm,
You know, the impact and the effects, was certainly on different levels, but the point is you had it and you could pass it on to someone else. So, there's got to be someone sitting there saying, "Hey, this is coming. Let's
mhm.
start doing this now." I know we're doing that,
Well,
right?
I think there's a lot of doubt. I think you have the healthcare providers who are putting the word out, you know,
Mhm.
and if you turn on the news, you can still see COVID, Corona, and I think as a people, we are just tired, you know, and we have a very dominant way of ignoring things that we don't want to
Okay.
deal with. I'm sorry.
Oh, that's alright.
Yeah, so
Hey, this is live. It
yeah,
happens. Look, we're
it's a
family.
human defense pattern that we ignore things that we don't want to deal with, and we are tired of corona. We want to pretend like it doesn't exist. We
Right.
want to believe that we are, for whatever reason, immune to the impact when that is not true. And
Right.
we're seeing it. Some many families, you know, I'm still delivering positive results on a regular basis. I'm delivering it to folks I don't know, as well as folks in my circle. You know, folks are still getting sick. So we need to kind of take our blinders off and see reality for what it is. Even though we've been through this, we're 2 years in, we're not out of the woods yet. And so we just need to be mindful because our lives matter.
So we talked about last week, Dr. Black, as we start, because I want to bring in our other guests, but I do want to. We talked last week about the funding
Hmm.
expired on today, and
Hmm.
that Congress would have to go in and approve some additional funding. I saw where some funding, a small amount, was approved, and I was like, okay, they've already addressed this, but it was for global pandemic health help.
Right.
I didn't see any for the U.S., which means again that it's going to shift to where the underinsured, the uninsured, and underserved are
Mm.
going to bear the brunt of trying to get help and get vaccinated and anything that's needed, which may be a little complicated or a little bit more difficult, especially if you don't have the funds.
Absolutely. And again, you're going to have to lean on providers who are willing to provide testing and vaccination at no cost
Mhm.
to the general public. And there are some providers who will do that, and
Okay.
but not a whole lot. And so if you're out there and you are uninsured, start looking now for those organizations that are going to be your go-to places when you or your family need access to these resources. Don't wait until you've got a cough, a headache, nausea, and then you're trying to look, because you are not going to be in a condition to try to research resources.
Well, you all are one of the locations for now, for
Absolutely.
underserved and uninsured, correct?
Mhm. Correct. So we are not, still not turning anyone away regarding of your funding source.
Well, we're so grateful for that. And again, every week, folks, please share this conversation because there's so much more information coming out. And I can assure you, not many people are talking about the funding that has ended. And then if they are, please let people know, because I get the impression that people aren't aware of what's happening and they're going to wait. And there's so much more we can talk about, the at home test and
Yeah.
kind of
Mhm.
the problems
Well,
that
I think
people are
I
having
think
with
at
that.
this point, Tanya, people haven't personally been impacted. You know,
Okay.
the first time that you show up to a testing site and you've been going regularly and you've never had to come out of pocket, the first time you show up and they ask you for your bank card or a check, you're going to be shocked. And it's
Right.
because we put our heads in the sand and we are not paying attention.
Yeah, good old America, boy. We have it like we have it, and then we end up reacting instead of being proactive. So, Dr. Tricia Black, Groundwater Solutions, groundwater-solutions.org,
Mhm.
704-596-0505. And I think your job fair is it this weekend?
It is
Yeah.
tomorrow.
Okay,
Tomorrow from
tomorrow.
10 to 3, we are having a job fair, a career fair here at our office. We're located at 5104 Reagan Drive in Charlotte, North Carolina. That is at the intersection of Reagan Drive and Sugar Creek near I-85. So we'd love to see you out if you just want to come learn more about us, or you are looking for a new career opportunity. We would love to have you.
And what's the address? I'm gonna put it in the chat, or can you add it in the chat as well?
I'll add it in the chat.
Yeah, please, and, please share everyone because you all have food and you got some, different people. I've seen, quite a list of people that are supporting this job fair, and, I just saw anyone today. I had a conversation this morning, and they were talking about some people possibly losing, where they're living, because of some vouchers, and I go, I get it, but everybody's hiring right now, and you gotta at least try to explore, and perhaps they are, and I know
Mhm.
childcare, and I don't wanna seem insensitive, but everybody's hiring right now. We
Everybody's
need
hiring.
to get
Everybody
them
needs help. And so we
around.
need
Right.
folks' mindsets to change and come back into the workforce, because
Yeah.
there's so many people out there who need your impact, especially in places like Genesis Project and Groundwater, where we are out there trying to make a difference, real difference in people's lives. And we need people who care to join us in that.
Absolutely. Dr. Tricia Black, Groundwater
Tanya,
Solutions.
I
I appreciate
cannot,
you.
I don't, my chat says private, so I don't know
Okay.
that when I
So give
send
it let me put it in real quick. It's a job fair and it's tomorrow, which
from
is
10 to
April 6th.
3 a.m.
Okay.
April 6th, from 10
Okay.
to 3 p.m., 10
Okay.
a.m. to 3 p.m., 5104 Reagan Drive,
Okay.
Charlotte, North Carolina, 28206.
28206.
Yes.
Okay, I got it in there for 6:10 a.m. to
Yes.
5104 Reagan Drive. Thank you so much, and
You're
everyone, again,
welcome.
please share. I appreciate you so much for joining us. And again, Dr. Tricia Black, Groundwater Solutions, 704-596-0505. Always great information and always informing us, keeping us abreast on what's happening in our community. And that's what I appreciate about Dr. Black, just a real love for helping everyone out. And it shows. I mean, job opportunity, job fair tomorrow. But every week we're holding conversations with her about someone if you're looking for employment. And they also have a lot of other resources that if you haven't been informed or not aware, you can go to my website, TanyaRivens.com, canceling COVID, and you can see some of these conversations. Now, let's talk about grief coaching, something we don't talk about enough. And Lord knows we've all had to grieve over something. And I'm not just talking about the loss of a family member. We're over 900,000 in this country right now of deaths contributed or attributed to COVID-19, over 20,000 in North Carolina alone. But I've got someone that's joining me right now, and I really appreciate having them. I consider them friends. There are two of them, so they're going to try to lean in. There they go together. Please introduce yourselves as the owners of Abiding Grace LLC. Good morning, Mr. and Mrs. Jones.
Good morning. I'm Willetta Jones, and this is my better half, Bill Jones, and
Morning.
we are the owners of Abiding Grace LLC.
Okay,
Which,
so now just tell us, what is Abiding Grace LLC?
okay, Abiding Grace is a nurturing company that helps individuals get through the grieving process. We don't diagnose, all right. We are a support system for people.
Okay. So
Mhm.
let's talk about grief coaching, because in our community, as Dr. Black and I was talking about before, and she was saying there's so many people that are grieving, trying to even make the conversation about mental wellness and mental health, normalize it, and therapy and things along those lines. Kind of tell us what grief coaching involves. What does that mean?
Well, with grief coaching, it's a support system. When a person decides that they need to have some support or help,
Hmm.
then we are the people to come to. All right. We, like I said, we don't diagnose.
Okay.
So there's no diagnosis. Uh, we start where people are and help them move through the process, their grief journey.
So now, is this, when you say grief, people automatically think about the loss of a loved one? Is that what you deal with?
That is one of the phases that we deal with, because
Okay.
grief comes in so many different forms. You can have grief from a loss of a job, from a loss of a pet, from a
Mhm.
loss of a relationship. There are so many different kinds of grief, and you can have cumulative grief where you have several things happening at the same time, where you don't get over one loss before you have another loss.
Mhm.
Okay, and there's anticipatory grief where you may be taking care of someone who's ill,
Mhm.
and the loss comes in the fact that the person is not the person who you've known before. Let's say
Uh,
if it were Alzheimer's, and a person has a condition that keeps them from being or functioning the way they usually are functioning, and so there you anticipate, even sometimes unconsciously, what is going to happen to my loved one, and if that person is in care, being cared for, and is in the process of dying, then you are in an anticipatory state. Okay,
so
so
look, go ahead. I just wanted to ask, so why do you suggest, or why, when people say, well, what do I need grief coaching for? Why is that service needed? You mentioned that cumulative grief and things that are going on. You know, how do you tell people, you need grief coaching? Because they're going to say,
well,
why?
a person has to want to have the support. It's
Okay.
not like if a person is going to a counselor or going to a medical physician or going to court and the judge says you need to go to counseling, okay, and mandates that. This is something that someone wants to do voluntarily. And that's the only way that the process will work, is because a person wants to have some help.
So anyone just hopping on, Abiding Grace, owned by Mr. and Mrs. Jones. I've known them for quite some time. A former coworker of mine, Mr. Jones. Hey, Bill, I appreciate you all so much. When people come on or sign up and say, "Hey, I need this coaching," what type of steps are taken? I mean, just tell me, is it just a conversation, or tell me how this all works?
Well, the first thing we do is we have what's called a discovery call. It's a free call
Mhm.
where I ask questions to determine whether or not we're going to be a good fit. It's like a glove on your hand,
Okay.
because working together, and we have to decide if this is going to work, because it's a partnership. So
Okay.
that's the first step, the discovery call. And then with the discovery call, I ask questions, excuse me, and then the potential client can ask questions, and we decide how we go in the future.
That might have been my light throwing you off. Sometimes it goes off and on, and I had to put
No.
in my notes. I don't know if that's what it was. I'm doing everything here, doing the show, producing, and doing the technical side. So I don't know why it's popping off, and my husband's upstairs. So, is this something that's covered by insurance?
At the present time, no, it's not, but we're working toward getting it covered.
Is this something that is growing in our country?
Yes, it is. It
Okay.
is a segment of life coaching. Life
Okay.
coaching
Okay.
started in the 1980s, and it has truly grown. And grief coaching has come out of the life coaching process.
So, what type of training, or what is it required for you to be able to start this type of practice?
Well, the training that we did was out of the Grief to Gratitude program out of Washington D.C. And you don't have to have a degree to be a grief coach, but we both are have our degrees. I have a master's from Purdue in special education, and that has also helped me with working with people who have needs. And we both have our
certification that we get from the grief program, grief coaching program.
Well, I've seen you actually featured as far as your qualifications and the professionalism that you've been able to provide. I've seen you featured in some of the I guess the circulars or the publications around the area. So it looks like you're starting to lead, like make an imprint as far as this whole professional field of working with people. And again, I see all this also tying in with mental health.
Yeah.
Can you kind of give examples of some without giving away too much privilege information if it's confidential of, typically those that you're working with and how you all have reached a resolution?
Well, what I do, I ask the clients if it's okay to use their situations without using their names. And
Okay.
most of them have said yes. And currently, I'm working with a woman who lost her father,
Hmm.
her husband, and her father-in-law in less than 6 months' time.
Oh my goodness.
And so, just dealing with just grief in general and dealing with the secondary causes of grief. For instance, like after losing your husband, then you lose a secondary issue would be losing monies from his salary and
Hmm.
being able to restructure your own life. It's not just, it's the grieving and this restructuring of everything in your life. So that is one of the people I've worked with. And
Well, no, I didn't mean to interrupt you. Go ahead.
mhm,
Trying to
um,
get my light back where it's supposed to be, so I
well,
apologize.
that's okay. And this is ongoing. We decide after we decide which how many sessions or packages or whatever a person is going to start with. As we get closer to the end, then a person can re-up and start the sessions. It's not that you stop at a particular time. It
Mhm.
depends upon a person's needs and growth. When they get to the point where they can be more independent and feel better about the whole process.
So,
'Cause
has it been what you all expected as far as this, whole endeavor taking off, or has it been slow? Or tell me how long have you been doing this, Abiding Grace?
well, Abiding Grace was established in July 2019, but we've been helping people, taking care of people all our lives. So it was through that. Both Bill and I are a mother's only children.
Uh-huh.
So we took care of my mom. We were responsible for my mom for 31 years, and we were responsible for his mom for 12 years. So we have a little bit of experience
Yeah,
about
you've got
taking
life
care of people. My
experiences.
mother was in a nursing home.
Uh So you can
Mhm.
certainly relate. I see Jocelyn, attorney Singletary has hopped on, and it's so great to see you guys. If you have any
Well,
questions, this is what we ask. If you have any questions, please let us know. Also, please share. That's the other thing. I have one follower that has at least 10,000, and they always share, and I'm so grateful for that because that's how we get the word out. It's
mhm.
Canceling COVID every Tuesday, 11 o'clock. Again, Groundwater Solutions, one of our sponsors, comes on and just to make sure that we're providing information that normally is not getting put out, especially in our community. So I appreciate you for allowing us to have this conversation. I think people would probably want to know how to get in touch with you, or if there's anything else you would like to add. Again, the goal is we're trying to normalize these conversations about
Yes.
therapy, mental fitness, mental wellness, grief coaching. These are things that we want our community everyone in the community, but especially our community, to start saying it's okay. You
Yes.
know, when you talk about someone that's lost 3 close people in their lives, and I
Yes.
look at how I lost 1 and how difficult it has been, that was really, really close. You know, it's you shouldn't be ashamed to say that you need help.
Right. It's okay. You know, and one of the things Dr. Ron Bell talks about is the fact that we need to think about grief the same way we think about happiness.
Mhm.
And it's not something that is discussed. It's not something that is taught. And so we have to start working with our families from children on up to know,
Mhm.
to let them know it's a normal, grief is a normal part of life, you know, and we grieve because we have loved. So
Yeah.
we need to be able to work through the process because, you know, a lot of times people will say, well, it's been 6 months and you need to be over that.
Yeah,
Nobody has the right to tell anybody how long they grieve. Now,
that's
if
true.
it gets to the point that they're really obsessed with it, then they might need to have more professional help. Okay. But to go through the grieving process, each person's journey is like their DNA.
Yeah.
All right. It's unique to them. So we need to know that it's okay to grieve and it's okay to get help and get support. We are a support system. Like I said, we don't diagnose.
I'm just curious. Some of the homes out have any partnerships in the making, or any type of working with them? I know, I would think that would be one way. And of course, we know that grief comes in different forms. It's not when you lose just a loved one. It might be the loss of a job, or as
Mhm.
you mentioned, a significant other, maybe a divorce. You know, different ways. But any conversation with them or any interest in trying to partner?
We have reached out to several funeral homes. So we're hoping and that things will work out with funeral homes and nursing homes,
And
you
that
know,
another good
assisted
one.
living.
Yeah.
Mhm.
So is there anything else you all would like to add as we start to wrap things up? Please share your website. I will type it in the chat as well. And I want to say God bless you for your ministry, because that's what you're doing. You are stepping in, much needed, serving our community. And that takes a really big heart to do what you're doing.
Oh, thank you. Our contact is abidinggracellc.com, and we're on Facebook. You contact us through our website or call 704-340-8400.
Okay. And let me get that. I'm going to put that up, type in again, trying to be the producer and everything. The number again is 704.
340
Okay.
8400. And
Okay.
we ask people that if we're not available at that time to please leave a message, because if it's a number I don't recognize, I will not call back.
Yeah, and unfortunately, we have to be that way because of so many scam calls that are coming through right now, which is really another conversation of
Mhm.
how people are being preyed upon right
Yes.
now when we're the most vulnerable. I
Yes.
just did a story of how the FBI talked about these virtual kidnappers are bringing in millions of dollars, because we're so vulnerable right now. And there are some other factors, but the fact is they're able to do it, and it's just sad that so
Yes.
many people are having to deal with that. So,
Mhm.
again, Abiding Grace LLC, abidinggracellc.com, 704-340-8400. Mr. and Mrs. Bill Jones.
Yes.
I think you have something
Yes.
else, Miss Willetta? Did you wanna add anything else at all?
Mm,
Just making sure. I don't wanna cut you off as we wrap things up. Did you have
we
anything else?
try. All right. One of the things, you know, in our community, a lot of times men do not want to get support or help. But
Mhm.
that's why Bill Jones is here. You know,
Okay.
and sometimes women don't want to talk to women because if they've had a husband for years and years and years, they may need to have some support from a male figure. So that's one of the ways that he is going to function. As Gabby as he is, I'm surprised that he's being so quiet
I
today.
defer to her on this.
I'm a little surprised too, but one of the coolest coworkers I ever had at WBTV, and one of the most understanding, and I appreciate you all. You've always been there for me, always been very supportive, and offered so much advice and leadership to me. And so for that, I say thank you. And thank
Thank
you
you.
again for this. So,
Mhm.
Appreciate it. Thank
Mr.
you.
and Ms. Jones. Absolutely. Again, we've got the information in the chat. Thank you for taking the time to talk with us.
Oh, you're most welcome. We appreciate you allowing us to be part of this chat today.
Absolutely. So again, that's Abiding Grace LLC, canceling COVID again, bringing you information because we want you to be informed, have the knowledge as you approach these decisions, especially as you're out and about, taking care of you, because you are one of your most important assets, and certainly no one's going to take care of you better than you can. Thank you again to Dr. Tracia Black of Groundwater Solutions. We appreciate her as always, one of our sponsors, groundwater-solutions.org, 704-596-0505. Their job fair on tomorrow kicks off at 10 o'clock, 5104 Reagan Drive. And thank you again to abidinggracellc.com is how you can find out information about grief coaching. Great information that I'm sure you can share and pass along to others. If you know someone dealing with grief for whatever reason they're grieving, now is a good time to refer them. It's time for me to move out of the way, my friends. As always, life's challenges make you better, not bitter. I'll see you on Saturday on Praise 100.9 FM, kicking off at 10 a.m. Please tune in. If you have any suggestions or you want to reach out to me about comments for the show, Tanya Rivens at AOL.com. Again, that's Tanya Rivens at AOL.com. Or you can use this email here. Look at me, RivensTanya at Gmail. Too many emails. RivensTanya at gmail.com. Because I love to have you on as we continue to talk about ways that we have to deal with COVID. It's not gone, folks. And there's so much that we have to deal with. So we're going to keep having these conversations. 2 years strong and still having more conversation. And fingers crossed, real soon, a big announcement of how we're going to be able to take this to another platform, continue here, but reach so many more people because of all that we've been able to do with this in the past. So have a great day, everyone. I believe rain is moving in this evening, so be careful. Try and stay dry. And do know that we'll continue to work together because together we certainly can cancel COVID. So have a great day, everyone. And thanks again for tuning in.